Hello everyone, my name is Sofia and today I'm sitting here with Dr. Rita, dermatologist. We are going to talk about the topic vitiligo. Welcome, Dr. Rita.
Thank you, Sofia.
So could you please tell us what is vitiligo?
Vitiligo is a disease which involves the color cells of the body. It causes loss of skin color in the form of big blotches which can be present at any body part, including the hair. It's a disorder of the immune system which makes the color cells to die, and they don't produce the pigment, the melanin. So it's basically an autoimmune disorder where the cause is unknown, you can say.
Yes. And which disease most commonly accompany vitiligo?
The diseases which commonly, they may not be accompanying vitiligo, but they may be a causative factor for vitiligo, like stress, severe sunburns, any injury to the color cells in the form of electric burns, fire burns. They all may cause loss of color cells, and you can get a big white patch.
And what can stop vitiligo from spreading?
Since vitiligo is a disorder of immune system, if you correct the immune system of the body by giving some harsh medicines like steroids, which are supposed to stop its growth, and correct your immune system by various means, like you can say by changing your lifestyle and doing some exercises, taking such diet, you can improve vitiligo.
Does halo nevi affect vitiligo development?
Yeah, of course, the halo nevi is a different form of vitiligo where it surrounds the hair follicle also, and that is very resistant to treatment. So it normally doesn't go except for surgical removal.
What are the risks of oral and topical corticosteroids?
Well, the oral and topical corticosteroids, if taken for very long, they can have their own side effects. Like if you are using topical corticosteroids for vitiligo lesions, you can say, they can cause skin atrophy and they make you more prone to the sunburn. And oral steroids, of course, everybody knows that they can cause Cushing syndrome, where you get obesity, hypertension, diabetes, joint problems, your osteoporosis. All these things can happen with long term use, and in vitiligo, unfortunately, we have to give them for very long time and in very high doses to control it from progression, otherwise it covers the whole body. So that from that angle, I mean, corticosteroid use has some side effects.
And which skin conditions can be mistaken as vitiligo?
Actually, whenever there is loss of color in the skin, everybody thinks it's vitiligo. But there are many conditions which just mimic vitiligo and can be easily treated with simple modalities. Like in children, we very frequently see white patches on their face due to allergic reaction or due to some deficiencies, but people mistake it for vitiligo. Similarly, there are some birthmarks, some nevi, which are present since birth, and they are present on a particular area of the body, and they don't neither increase nor they decrease. They just increase with the growth of the body, and some people mistake it for vitiligo. Similarly, any injury, as I previously told you, any road injury where we have the scraping of the skin when we lose our color cells, a simple white patch may form, which is mistaken as vitiligo.
And can chemicals create vitiligo?
With certain household chemicals which we use frequently, like phenolic compounds in our toilet cleaners, all the cleaners of the tile cleaners, continuous exposure to these compounds can cause vitiligo, and certain chemicals in our hair dye products like paraphenyl diamine, even that can cause depigmented patches just like vitiligo. Certain chemicals present in our cosmetic products, in India it is very commonly seen at the point where they use bindi, vermilion, on the forehead. At that point, vitiligo develops. Some lip liner compounds also contain such chemicals which can cause vitiligo with perioral depigmentation.
And how do you prevent it from getting worse?
early diagnosis and early treatment, and of course these products, as I've told you, you should not use these products for very long time and very frequently. And early treatment, if it is vitiligo, then early treatment can definitely control it.
And how many years does vitiligo take to spread?
Normally vitiligo spreads very fast. It takes, although it starts in later ages, not at birth, but it takes from 6 months to 1 year to violently spread on the body, and suddenly, abruptly it stops growing.
And what is the fastest way to cure vitiligo?
Actually, you cannot completely cure vitiligo. You can arrest its spread, and you have to take very aggressive treatments, like in the form of steroids, certain hepatotoxic agents like 8-methoxysorolines, some topical agents. All these are required to arrest its growth. But to remove the patches which have already developed, we have to go in for some certain surgical procedures.
How long does it take to treat this vitiligo?
As I told you, you can control it, and if you have taken aggressive treatments, of course you can arrest its growth. But whatever patches you have developed, you have to go in for certain graft therapy, some melanocyte transfer therapy. You can have, all these things can improve your vitiligo, and you may get cured of it.
Can a gluten-free diet help with vitiligo?
As with all other autoimmune disorders, any diet which is rich in antioxidants, phytochemicals, any healthy diet can improve vitiligo. Not specifically gluten diet, I mean the food which are very low in glycemic index, they are supposed to improve your autoimmune disorders. And lots of antioxidants in the form of minerals, vitamins, green leafy vegetables, all these are supposed to improve vitiligo. Certain diets, although, are not to be taken in vitiligo, like some varieties of fish have been seen to aggravate vitiligo, and vitamin C, because it is a photoresistant chemical, so it also hampers in the melanin production. So you have to restrict these diets when you are on vitiligo.
Can you suggest us any herbal treatment for vitiligo?
Yeah, since long time the bapchi seeds, all our ancient books also mention this bapchi seed, which is a derivative from a plant. Rather, all the allopathic medicines used for vitiligo are derived from these plant derivatives, and they give it in the very refined form, which become hepatotoxic. So if we use these compounds naturally in our herbal medicines, then of course they will not do any harm to the body, because they are in very low concentrations, and they definitely photosensitize the vitiligo areas and get you pigment.
And what is the duration of this treatment?
Since the treatment is not does not have any side effects, so it can be taken for long time. As I told you, because the vitiligo takes just 6 months to 1 year to develop completely. So during that period, if you take the medicine for 1 year, I think you can arrest the vitiligo growth and restrict it to just a small patch or so.
So Dr. Rita, thank you so much for joining us today and giving us so much information about the topic vitiligo. Now we know how much mental treatments can help us out.
Thank you, Sophia.
Thank you. If you would like to receive this treatment, you can order it from our website, or you can contact us at the below mentioned number.